Hello everybody. My presentation today is going to be on types of diabetes and the prevention of the disease by Ebele Onyanusi at Brandman University. What is diabetes? Diabetes mellitus is a chronic disease that results from either the inability of the beta cells of the pancreas to produce enough insulin or due to the failure of the body cells to effectively use the insulin produced by the beta cells of the pancreas. Types of diabetes mellitus. Prediabetes is a serious health condition with blood sugar level higher than normal but not high enough to meet the diagnosis as type 2 diabetes, which is a state which a patient can be before he is diagnosed of type 1 or type 2 gestational diabetes. Type 1 diabetes is when the beta cells of pancreas produce little or no insulin and is commonly found in children. Type 2 diabetes is due to the resistance of the body cells to insulin produced by the beta cells of the pancreas, while gestational diabetes is blood sugar above normal value but below the values and used for the diagnosis of diabetes and occurs during pregnancy. Diabetes can be prevented by achieving and maintaining healthy body weight. Be physically active for at least 30 minutes, eat healthy, avoid saturated fat and sugar and tobacco use. I'm going to take you to World Health Key Facts World Health Organization Key Facts on diabetes. World Health Organization states that the prevalence of diabetes has been on the increase among the middle-aged and low-income countries. The major cause of blindness, kidney failure, heart attack, stroke, and lower limb is caused by diabetes. Almost half of the deaths attributed to the high blood glucose occur before the age of 70 years. World Health Organization estimates diabetes was the seventh leading cause of death in 2016. Healthy diet and regular physical activity, maintaining a normal body weight, and avoiding tobacco use are ways to prevent or delay the onset of diabetes. World Health Organization also defined diabetes, which we've done earlier in the PowerPoint. They also discussed about type 1 diabetes, which is previously known as insulin-dependent, juvenile or childhood onset. Type 2 diabetes, formerly known as non-insulin dependent or adult. Gestational diabetes is commonly seen in pregnant women. Common consequences of diabetes by World Health Organization. Adults with diabetes have 2 or 3-fold increased risk of heart attack and strokes, nerve damage which can cause diabetic neuropathy, diabetic retinopathy which can cause blindness, and kidney failure which can cause kidney disease. Burden of diabetes to be reduced. Burden of diabetes to be reduced can be done by achieving and maintaining healthy body weight, be physically active at least 30 minutes regularly, eat healthy diet and avoid sugar and saturated fat intake and avoidance of tobacco use. Diagnosis and treatment. Type 1 diabetes can be treated with insulin, and type 2 diabetes seen in adults can be treated with oral medication and sometimes insulin, and gestational diabetes is also treated with insulin. World Health response on diabetes is to provide scientific guidelines for the prevention of major non-communicable diseases including diabetes, develops norms and standards for diabetes diagnosis and care, builds awareness on the global epidemic of diabetes, marking World Diabetes Day, November 14, and conduct surveillance of the diseases and its risk factors. As we are through with the key facts on World Health Organization, I'm going to take you to the flyer I created, which is going to give us the overview of diabetes mellitus. Diabetes is on the rise. About 422 million adults have diabetes. 1.5 million deaths has been caused by diabetes mellitus. Main types of diabetes are type 1, type 2, and gestational, which is the temporary condition in pregnancy, and the consequences of the diabetes on body organs are stroke, blindness, heart attack, kidney failure, amputation. Thank you so much for listening. Have a blessed day. Bye bye.